Republican plan to repeal Obamacare has cleared its first major hurdle. President Trump and the bill's supporters celebrated their victory in the White House Rose Garden. The House narrowly approved the bill. Democrats and many health care providers denounced it.
The American Health Care Act replaces Obamacare's health insurance subsidies with an age-based tax credit to purchase coverage. States can ask for waivers so insurers can charge higher premiums for people with pre-existing conditions. States would have to set up high-risk pools to help pay the cost. The bill passed the House nearly 4 months after Mr. Trump told the Washington Post, "We're going to have insurance for everybody. It will be a much simplified form, much less expensive, and much better."
With us now is Dr. Robert Pearl, Executive Director and CEO of the Permanente Medical Group. He's responsible for health care provided to more than 11 million Kaiser Permanente members. Kaiser Permanente is one of the nation's largest nonprofit health care providers. Pearl is also the author of Mistreated: Why We Think We're Getting Good Health Care and We're Usually Wrong. Dr. Pearl, good morning.
Good morning.
Great to have you here. How do you see this bill out of the House of Representatives?
It's just a first step. As Charlie said, it has to still go to the Senate, where it's going to invariably have significant changes sitting in play. It'll have to go to conference committee. This has a long way to go before it's the law of the land.
Suppose the Senate would come to you and say, you're involved in health care. Tell us what we need to do. What's not in this bill or what's in this bill that shouldn't be?
Pre-existing conditions is key. We've got to make sure we provide coverage to those who are the sickest in this nation. We also have to make sure that health care is affordable. If you can't get health care, if you can't pay the out-of-pocket premiums, you're not going to get that care. And then finally, it's got to have adequate coverage. So when you go to the doctor and things are done, that it's going to be paid through your program. And I'd say the last part is that it's got to be at the delivery system. It's got to be better organized.
So, can I ask, forgive me, because I think this is important, because there are a number of Americans who have pre-existing conditions who are really worried. And my understanding of this House bill is that it would allow states to do a waiver. What does that mean for someone who has something like diabetes or cancer or who has had heart surgery?
Well, we don't know yet because no one's done the waivers. That's the key part of the bill that I'm saying. The unknown piece of the bill is that we don't know what's going to happen through these waivers. We could have 50 different bills. Each state could handle it differently, and it might be different in New York than it is in New Jersey and different in Connecticut than California.
It seems to be that there's a lot of coulds in this bill, a lot that we do not know. What is it that we, the patient, because at some point all of us will be patients, what is the thing that we should be most worried about or concerned about?
We have to make sure that we maintain the coverage for all the people who have it today. We have to make sure that you can have coverage without having access if you can't afford it. So the opportunity for everyone to get the health care that they have today is crucial to maintain, both for those with disease and all of us at some point will get disease.
Well, then does this bill provide that came out of the House?
At this point, I can't say because of all the provisions that we don't know. And as I say, also the fact that the Senate's going to be there.
What's interesting about this, even when they voted on it, they had not read the bill because they had not had a chance to prepare the bill, correct?
I don't know whether they read it or not, but the bill is still in a work in progress. And at some particular point, after it's in the Senate, it's going to go to the Common Committee, where finally the bill will be put into the final form.
The President, talking about the Australian Prime Minister, said they have a better health care system than we do. So the question that I have is, who has the right health care system, and what should we try to create?
The most important thing, and we're not even talking about it yet, is the care delivery system. Most of these bills are about coverage. Who's going to pay? How much are they going to pay? Who's going to get the ability to get the care? But what's key is the delivery system. Is care integrated? Do physicians work together as one, horizontally within departments and vertically between primary care and specialty care? Of course, this nation's often no. Is it prepaid? So it's not driving up volume, it's getting value. People are focusing on unnecessary deaths. 500,000 people die every year in this country.
Why?
They die from a combination of failures of prevention. They die because of medical error. My father died from medical error, that book you mentioned. It starts with the story of my father. And they die because of disparities in outcomes based upon race. 500,000 people. You can't get the convenient care, the care all three of you want to get in your travel, in your banking. Can you go online and make an appointment with your doctor? Can you email? Can you video? No. You accept so much less in your health care. than anywhere else. We've got to change that in the United States.
They say that older Americans will see higher premiums under this proposed bill. Is that true?
What you're describing is the fact that under the Affordable Care Act, the maximum you can be charged based on age is 3 times the lower premium. In the new bill, it's 5 times. And then the waivers, no one knows. A lot, as Charlie said, no one knows.
Mm-hmm. And what about mandating preventative care services?
That's the coverage piece. Absolutely. If we don't do the things in advance to prevent disease, then people are just going to get sick, and the cost is going to rise over time. And over time, if the cost of health care exceeds our ability to pay, every insurance plan will fail.
Would you acknowledge that this Republican plan in repealing and replacing Obamacare puts more power in the hands of insurers like you and out of the government?
I think it puts more power under the states is where it's going to be. This is moving from the federal one-size-fits-all to the possibility of 50 different sizes coming out of this particular plan.
Why is it so hard, Dr. Pearl? Everybody says they want good health care, they want it to be less expensive, they want it to be inclusive. In one sentence, why is it so hard?
Because we have yet to make the delivery system be a 21st century delivery system. It's left over from the past. It's like the 19th century cottage industry of England. It's fragmented. Doctors scattered around the community, hospitals in every town. Yeah. It's paid on a piecemeal, fee-for-service basis. The technology is a 20th century technology. All the modern things could be done. It's not in American healthcare today. It's got to change.
Thank you for coming.
Thank you, Dr. Pearl.
Thank you so much.